Good morning. My name is Peter. Welcome to NTVT's in Nyumbani. Today we're going to do a totally different way of working out. We're going to do hip and glutes workout only, okay? We'll of course try see if we can, if time allows, we can mix a bit of the core. But our main purpose today, we're working on the hips and the glutes. This is mostly for people who have issues with their hip. If you have a hip problem, a weak hip and all that, this will be very much ideal workout for you that you can do at home. No equipment required. But in case you have some dumbbells or the water bottles that we've been using in our previous workouts, you can place them close to you, as you might use them to maybe add up a bit of weight and resistance on that on a particular workout. Welcome on board. We're going to warm up with a plank walk. We're going to do at least 15 plank walks, then come up, then we start off our first hip workout. I hope you're ready and I hope you enjoy the workout. So we're doing a hip walk. Sasa, twende hapo. Give me a tap on the shoulder, then walk back up. That's one. Take your time. You can go slow. You can go faster. There's no rush. Come back up. Those are 3. We're doing 15. Tap your shoulder. Come back up. Those are 4. Those are 5. Those are 6. If you can't sustain your weight up, you can place your knees down as you walk. You tap your shoulders, then you try lift your knees up. If you can't, just come the closest you can. Then jinue juu hapo. Then you stand, okay? I'll repeat for the 7th count. Take your hands down. Put your knees up, down, sorry. There. Tap your shoulders. Walk back. Jinue juu. There. Then you hold, okay? If you can, we're here. Walk up. Those are 8, 7 to go. 9. 10, 5 more. 1, 4 to go. 2, 3 more. 2 to go. And last one. Whew, awesome. Our first workout, we're doing a fire hydrant. So you're going to go down on all your 4 paws. You're there. So for a fire hydrant, you're basically lifting the knee up, okay? Hapo mguu moja on the side up. Okay? It's a glute workout. We're doing 20 reps. All the workouts today. Let's try and work with 20 reps. Are we ready? We start with one leg. 20 reps. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Those are 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. Those are 20. The other side. If you have ankle weights, if you have any weights, ankle weights or a small dumbbell, a kg or anything, you can add up some intensity by placing the dumbbell here in between apple. Then you lock it in. Let me demonstrate. Then you are able to push the weight out, okay? You can use a dumbbell, at least if you want to increase the intensity. If not, if you have an ankle weight, place it on your ankle, then it gives you a bit of that much more resistance. So we go on the other side, we balance, 20 reps. 1, 2, 3, take your time. 4, 5, 6, 7, 8, 9, 10, 10 to go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. How are you feeling? You're just getting started. Remember, like I said, this workout can be done by even people who have hip issues. If you have a weak hip, if you have hip problems or hip challenges, and you're trying to strengthen your hips, these are going to be one of the best. This is actually going to be one of your best shows today. So get to join in, and I'm sure you get something that will help your hip as you strengthen the hips and the glutes. From there, we're doing a donkey kick. So we're still more or less on the same position. Take the leg, kick it back, hapo. We ready? 20 reps. Let's go. 1, 2, bring in the knee. 3, 4, 5, 6, 7, 8, 9, 10. 10 to go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Those are 20. Balance the other leg. Same, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 to go. 10, push it. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. Perfect. From there, we're going into the glute bridge. Now, for the glute bridge, if you have some dumbbells, if you have a water bottle like this close to you, kama iko karibu, I can give you a minute. Kimbilia chukua, put it closer to you. 5 liter, 10 liter, depending on how much of weight you have. If you have dumbbells, you can still use the dumbbells. I have 2 dumbbells, 5 kg, so I prefer using them to demonstrate. So we are there. If you don't have weight, or if you can't actually do the workout with weight, so this is the workout, the glute bridge. You go up, then you come down. Okay, up and down, squeezing the glutes when you go up and down. Okay, perfect. So if you want to add a bit of more weight or intensity on the workout, using the dumbbells or whatever weight you have around you, place it there by your tummy. Mikono hapo nje, shikilia weight. You come up, then down. Let's go. 1, 20 counts. 2, breathe. 3, 4, 5, 6, 7, 8, 9, 10, 10 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Perfect. I hope you're feeling good. From there, our next workout, we're doing a clamshell. So I want you to bend your knees hapo. Funga miguu. Your toes, ziangalie mbele, ziangalie juu, okay? So all I want you to do, unue mguu moja hapo, then down, okay? Up and down, up and down. We're doing 20 reps. It's a clamshell. You ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 to go. 1, 2, 3, 4, 5, push it, 6, 7, 8, 9, those are 20. Good job. Now I don't want to show you my back, so I'm just going to turn my side. It's the other side, so I'm able to do and balance the other leg. Okay, are you ready? We start. Let's go. 1, 2, 3, 4, 5. Good workout for your hips. 6, 7, 8, 9. Those are 10. 10 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I'm sure you're feeling something. I am. Good. From there, tunaingia a straight leg raise. Okay. Now, the straight leg raise, I want you to put one leg ikae chini flat, the other one you bend it to the knee. Okay, up. So when we do, what we're doing with this leg is we basically raising it, as the workout is called a straight leg raise. So we're raising this leg to the same level as the other knee. Hapo. The same level, then you take it down. Now I want you to suspend the leg on air just to put more tension. So usiguzisha chini, try suspend it in the air up, okay? For 20 reps. Are we good? Get into position. If you have a pillow, you can place a pillow hapa chini ya kichwa yako so that you don't strain your neck. Otherwise you can hold it like me, hapo. But if you have a pillow, kindly place a pillow so that you don't get a neck pain hapo. Okay? Can we start? Good. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 more. 9 to go. 8 to go. Last 7. 6 to go. Last 5. Last 4. Last 3. 2 more. And last 1. Awesome. Haha. Relax the leg. I'm sure you're feeling it. Good. Balance. The other leg. Same. Fold the knee. The other leg is straight down. We're going for 20 reps. Are we ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 to go. 9 more. 8 left. 7, 6, 5, 4, 3, 2, and 1. Good stuff. Are you okay? From there, our next workout, we're doing a hip abduction. Okay, there are 2 workouts. We have an abduction workout, then we have an adduction workout. So we're going to start with the abduction workout. So the leg in your chini, I want you to place it back, nyuma, then the toes yangalie nje pia, sawa. Then one leg is on top, right? The toes pia face up, okay? You can hold it at that position. So all I need, we're working with the leg that is on top. So we're raising it up and down, up and down, okay? That's the abduction. So we're doing 20 reps. Are you okay? I hope you're following so far. Good job. Higher. So let's start. 20 reps. Let's go. 1, 2. Isiguze chini. Try suspend it in the air to put more tension, okay? 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. I'll still turn. It's because I don't want to show you my back, that's why I'm changing. For you, you can turn so long as you understand the workout. If you don't, if you just joined us, we're doing the hip abduction. So the lower leg in your chini, this other one up. Your toes, make sure they're facing up. Okay, so we're doing 20 reps. Are we ready? Let's go. 1, 2, 3, 4. Keep the legs straight. 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and last one, 10. Good job. We're going now to the adduction, okay? With the adduction, we are more or less going back to the same position when tulikuwa, but now the leg that was on top, I want you to do either one of the two options. So the leg yenye ilikuwa chini becomes straight, okay? So let's say both our legs are straight there, okay? The leg that is on top, you have two options. You either place it there or you place it at the back. I don't know how comfortable you are. In case you can't cross it, I would prefer you have it here at the back, okay? You still be able to do the workout. If you can't cross it over there, okay? I'll cross it over. So the work that we're doing, we're using the leg the yenye chini, okay? So we are basically lifting the leg up there. Okay, that's what we're doing for our adduction today. Are we ready? 20 reps. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. Ooh. Feels good, eh? Good stuff. It doesn't matter whether you have a hip injury or your glutes are weak or your hips are weak. Try this workout. It's good for everyone. Those recovering from such an injury, those who want to strengthen their hips, those who are still okay. I'm okay. I don't have any hip issue, but I still want to have my hips strong and my glutes strong. Okay. So tuendelee. Back leg straight. We good? We start. 1, 2, 3, 4, 5, 6, 7, 8. Remember your toes na kuangalia. 9. Woo! 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20. Tusimame kidogo. How are you feeling? Good stuff. Now, let's change kidogo, just at least to get off the mat a bit. So we're going to do a seated squat. Others call it a stand-up, different name, but anyway, this is what we're doing. I want you to crisscross your hands on top of your shoulders, there. So we're just sitting on the chair and coming back up. So you sit, you come back up, okay? We're doing 20 reps. Also very good for your hips, okay? Are we ready? Good stuff, let's go. 1, 2, 3, 4. Just tap the seat. 5 or sit on it, depending on if you have any injuries. If you can tap, come up, awesome. If you can't, sit on it, then come up, okay? Those are 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good stuff. Perfect. From there, doing your lunges. Okay? Lunges. Depending on if you have an injury or not, a knee injury or back injury, take it to the farthest you can. Okay? So this one I will not pressure anyone. Do it based on how you feel your body or how far your body can actually push the workout. Okay? For me, I don't want to use any equipment. I have some dumbbells. I can hold the dumbbells. If you want to add some intensity, for those who have dumbbells at home or even the water bottles, you can still use them. This is what I want. Then you come back to the center, you step, and you come back. Okay? If you don't want to use the weight, it's fine. You can place them down. If you have them, use. If you don't want, it is sour. Okay? So we're doing 20 reps. So we're doing 10, 10 on each leg. Can we start? Let's go. That's 1. That's 2. That's 3. That's 4. 5. 6. 7. 8. These are 9. Those are 10. Place the weights down. How are we feeling? So now, those are the workouts I want you to repeat. That's how you repeat that whole series of workout starting from the fire hydrant. Okay? So let's do a recap. Because of time, we'll do a recap of 10 reps on each side. Okay? 10 reps on each side, so that make sure that you get the workout and the form correct. Download the workout on NTV Facebook page and ensure you give this workout to someone who needs it for their hips. It's good. So we start with fire hydrant. We're doing 10 reps. Okay, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we did the other leg as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. From there, don't kick it. Let's go for 10, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The other leg. 10, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Glute bridge. We're doing 10. Okay? These are recap for those who might have joined us. So we're doing the glute bridge. We're doing 10. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Those are 10. Good job. Clamshells. Here, Kadisha Migu. There, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The other side, balance, 10, 10. You ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Straight leg. Okay? 10, 10. You ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Tunaingia abduction for 10 reps. Are we good? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other side. Abduction still for 10. Change. We ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. From there we start with the abduction. Cross the leg. Let's go 10. 1, 20 kazi. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Cross over the other side. Change for 10. Same. We good? 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lunges, tano. We're just doing a recap, guys. So we're doing 10 reps. So we're doing 5, 5 on each knee, okay? We start. That's 1. 4 to go. That's 2. That's 3. That's 4. Last one. That's 5. Good job. So we stretch. We're here. So thank you for staying tuned to NTV. Teasing nyumbani. I almost said mtaani, but it's still coming. After Corona, twist your neck round. The other side. We stretch here. Remember, get this workout from NTV page. Please download it. Do it at home. Do a minimum of 4 sets. At least 20 reps each. 20 upper. 4 sets, 20 reps each workout. Okay? A minimum of 20 to 30 reps would be ideal. And I can promise you, it will help you strengthen your hips. Right. Get it here. Twist your ankle around. The other side. Bring it in. Breathe in, breathe out. Breathe in. Out. Breathe in. Out. Last one, breathe in.
Hello and welcome to Your World. This is a show that looks at how COVID-19 is affecting different areas of our lives and sharing tips and experiences from different parts of the world as we continue to make the new normal our normal. Good morning, my name is Joseph Warungu, and on the program today, What's it like when you get infected, hospitalized, and then recover from COVID-19? What's the experience of doctors on the front line who attend to those in hospitals day in, day out? Today, we focus on COVID-19 survivors. With children having been at home for quite a long time, schools in Bangkok reopen, but with high levels of social distancing. Your child will most likely not be going back to school this September as earlier projected by the Ministry of Education. Marseille residents transform homes to host graffiti art. This morning we're asking you, do you think COVID-19 is real, and are people still taking it seriously? Do you think this disease is actually real? Are people taking it seriously? We want to hear from you, your comments and questions. Welcome on our hashtag New Normal. And if you are a survivor of COVID-19, we also would like to hear your experiences. You can reach us via our phone lines and our WhatsApp line as well. But first, here's a picture of COVID-19 around the world. And as at this moment, 10,803,599 people across the globe have tested positive for COVID-19. And out of these, 6,028,298 have so far recovered from COVID-19, while sadly we've lost 518,968 people around the world as at this moment. Here in Kenya, this is the situation. We have 6,673 people who've so far been confirmed positive for COVID-19. 2,089 have recovered, and unfortunately we've lost 149 people in Kenya. Moving across the East African region to Somalia, 2,924 people confirmed positive, 932 people have recovered in Somalia, and so far 90 people have lost their lives as a result of COVID-19. In other parts of East Africa, in Uganda, these are the numbers: 893 people so far confirmed positive for COVID-19, 837 have recovered, and no one has so far been reported to have died in Uganda. Elsewhere, to the south, to Tanzania, again, numbers that don't change a bit. 509 people confirmed positive for COVID-19 in Tanzania from the last time they reported quite a few weeks ago. 183 have recovered. 21 people in Tanzania have so far lost their lives as a result of the disease. In Rwanda, this is a situation. We have 1,042 people confirmed positive for COVID-19. 480 have recovered. 3 people have so far died in Rwanda as a result of the disease. And finally, in Burundi, we have 170 people who have been confirmed positive for COVID-19. 115 have recovered, and 1 person has so far been reported to have died from the disease in Burundi, a country whose president is now saying that the country needs to take this as a real national emergency. Now, your child will most likely not be going back to school this September as earlier projected by the Ministry of Education. This is based on the advice given by medical experts who say the COVID-19 situation in the country is expected to reach its peak around the same time. NTV's education reporter Sharon Baranga with more on the story.
The possibility of seeing children in class in 2 months' time was the subject of discussion between education stakeholders, including the Kenya Union of Post-Primary Education Teachers, Kenya National Union Teachers, University Academic Staff Union, the Teacher Service Commission, among others. The answer not such an easy one to come up with, even for all these teachers.
We have also been reliably informed this morning by the doctors that the peak is likely to come in September, and by the grace of God, perhaps taper down around January. Taking all those factors into consideration, including the fact that the good government of Uhuru Muigai Kenyatta has taken the children to school. Every child went to school using the 100% mop-up transition. Therefore, the children are at school and the schools are a bit congested. And that whatever is going to determine whether we open or not would depend on whether social distancing can be achieved in school.
As for the verdict,
so we have reached a consensus. It is not my place to tell you which consensus we have reached, but by Monday the 6th of this month, His Excellency the President, who is the owner of the process, will make certain pronouncements which will be advised.
Schools were closed on March 16th, 2020. Since that time, some learners have been able to continue their studies online, but a majority did not have that luxury. The one certain thing currently is that learning will resume from where students left off during the first term.
The position of the parents has been very firm that we don't open until we achieve stability, which means until the curve is flattened.
President Uhuru Kenyatta is expected to give direction concerning reopening of schools from recommendations made by the 10-member task force appointed by CS Magoha to look into the reopening of learning institutions amid the coronavirus pandemic. Sharon Baranga, NTV.
Now, could it be that the increasingly sexualized content around us is corrupting our minds and behavior?
Raunchy, to say the least. In a world where access to digital devices is as easy as accessing all manner of alarming sexual content, the effect on human behavior may be manifesting itself in a disturbing sex culture. The Kenya Film Classification Board says a changing media and civilization may be cultivating a disturbing sex culture. But experts say society must reflect on the effect of the paradigm shift.
All the days when we didn't have exposure to this kind of videos and music is we didn't normalize sexual activities. But now the messaging is sex is normal.
Sexualized content has been there for decades. And yes, we have more access to sexualized content now. But because it has been around for so long, it doesn't mean that because it's the numbers are high.
Just a month ago, shocking explicit images and videos emerged on social media platform Instagram, showing minors engaging in obscene activities. With that in mind, Julie says change is already here with us, and we must now think of damage control through capacity building.
If we look at the education and the gaps in the education, then we'll see that sexual reproductive health is a huge gap. And as long as that gap remains there, then we're going to have teenage pregnancies, we're going to have incest, we're going to have issues around rape.
Then there's the threat of sex predators lurking online in search of easy prey. A few weeks ago, the Daily Nation published a report on how a female minor was lured into indecent sexual acts through Facebook. The Directorate of Criminal Investigation says the numbers are rising, with 300 cases reported daily at the minimum. Counsellors say it is important to understand the psychology of a sex offender if one is to stop them before they pounce.
They have suffered some psychological harm. And so the act is not about the sexual satisfaction. It's about control. It's about power and asserting authority.
They would groom their audience. If it's somebody who's trying to groom a child, then they get into the mind of the child. They get into knowing what kind of things that they enjoy watching, what sort of books, what kind of music, all that kind of grouping.
Tell me and I forget. Show me and I may remember. Involve me and I'll understand. A famous Chinese proverb that may well drive the agenda and conversation towards preventative measures now that the digital disruption is here to stay.
The Ministry of Health says it will take decisive action against Lancet Laboratories should it establish instances of neglect that led to alleged erroneous COVID-19 test results. Lancet Group Managing Director Dr. Ahmed Kalebi, who earlier on appeared before the National Assembly Health Committee, defended the lab's COVID-19 testing procedures despite relaying different results from the National Influenza Center in a recent case. NTV's Seth Olale followed the proceedings at the Parliament buildings.
Honorable.
The National Assembly Committee on Health, chaired by Muranga Woman Rep Sabina Chege, sought to seek clarification from Lancet Laboratories over alleged COVID-19 erroneous results in a matter where Kiambu MP Jude Njomo's late mother tested positive for the coronavirus after tests from Lancet, only for the same sample to turn out negative at both the Nairobi Hospital Lab and National Influenza Center later.
I want to be the devil's advocate. Would the result be influenced by any outside forces by any chance?
Madam Chair, I can swear by the Quran, no, never. In fact, if you came to do the test in my lab, I might not know that you did the test in the lab until you get your results and you call me.
Lancet also admitted that there have been multiple cases where its results came out positive only for them to turn out negative at other COVID-19 certified test labs in the country.
You do get disparity between test samples that are tested at different times.
Lancet, which has its mother branch in South Africa, denied any interference from outside forces.
I want to state categorically on my honor and my name, nobody influences our results anywhere. In fact, if anything, I do get people come to me, including very senior people, including politicians, who come and say, I want to do a test, but don't give a certain type of results. I will never do that.
Quite a damning allegation on the leaders, but the Ministry of Health is currently keen on investigating Lancet. The Ministry of Health is currently keen on investigating Lancet over various COVID-19 test anomalies, vowing to take action should it establish any systemic errors.
It is possible that anything could have gone wrong along those lines. What we also have on top of that to ensure that labs are producing the right results is we have a quality assurance system or protocols where we send samples to these labs from time to time just to check and see if they're doing the right thing. We are addressing this issue. It has come to our notice of certain labs where this is happening, and we are addressing it. We are re-evaluating those labs. If we do find that there has been some negligence, we will certainly take the necessary measures so that we don't get wrong results.
The legislators faulted Mater Hospital for failing to disclose to both the late Kiambu MP, Jude Njomo's mother, and her dependents that it had carried out a COVID-19 test, as well as breaking the news to the family and professionally.
My main objective of bringing this to the committee is to ensure that we will have systems working for the country so that no Kenyan will go through a false or an erroneous laboratory results and face the kind of consequences that any family would face going through what I went through or going through what other Kenyans have gone through when their people have been tested positive or they are not positive.
The National Assembly Health Committee will as well meet senior Ministry of Health officials next week to discuss similar matters regarding the test procedure and results for COVID-19. Seth Olale, NTV, Parliament Buildings, Nairobi County.
So this morning we are focusing on COVID-19 survivors in Kenya and elsewhere in the world. And joining me is a panel of various people. We have Dr. Sue Adongo, who's an obstetrician gynecologist, who is joining us via a satellite link here in Nairobi. Margaret Njehia is a clinical psychologist with me here in the studio. We'll also be joined a little later by Professor Julius Oyugi, a virologist in the Department of Medical Microbiology, University of Nairobi. We have via Zoom Hannah Thompson, a law student and a survivor as well in the UK. And we'll also be joined a little later by Lucy Oswizibo Okechuku, a COVID-19 survivor in Nigeria, as well as Saye Zaland, media manager at AIPS Asia, based in Germany, and also George Morara, a psychiatric nurse, who will also be joining us on the line from the UK. Now, let me start with you, Hannah. Good morning and welcome to Your World.
Morning. Hello.
Now, tell me, what was your experience? First of all, how did you get to know or to find out that you were positive?
So my dad is actually a nurse. He's the deputy manager of a nursing home. And everybody in that nursing home actually contracted the virus. They showed positive test results. So he came home, and I live with both parents, my mum and my dad, and the virus spread almost immediately to both me and my mum too. So we went and got a test as well, and we were shown as COVID-19 positive as well.
What kind of symptoms did you have?
So for the first 3 days, I had an awful pain in my left nostril, and I was having migraines, tiredness, quite dizzy and lethargic. Just doing normal day-to-day tasks was quite a struggle for me at the time. But the symptoms gradually got worse, actually. So on the 4th day, I got a terrible case of sickness and diarrhea. And my mum was exactly the same. She had the same sort of symptoms as me. And these lasted for 5 days with the sickness and diarrhea. I couldn't eat for 3 days. I was vomiting every day. It was dreadful. But the crazy thing is, when you see it on the news and on adverts, people are always talking about a consistent cough or a dry throat. I did not have any of those symptoms at all. Mine were completely different. It was sickness and diarrhea. And my mum was the same. However, my dad, he actually has underlying health conditions, but he actually had the virus very minor and less serious compared to me and my mum. He just had minor cold and flu symptoms, which is strange because they do say that people who are more vulnerable with underlying health conditions are more likely to suffer the virus like a lot worse. So that was quite strange for us. We were quite shocked at that.
And so, how long were you in hospital?
So I didn't actually have to go to hospital. I was very, very lucky. Me and both parents, none of us had to go to hospital. So over here in the UK, just because you get a COVID positive test doesn't mean that you have to be hospitalised. You can self-isolate at home for 14 days. But obviously, if you get any breathing problems, you would have to be admitted to hospital. However, we were very lucky and that wasn't the case for us. I just stayed in bed for about 7 days, and then 2 weeks, even after the 7 days of feeling really unwell, I was still so tired, exhausted, couldn't get on with normal day-to-day life. But as well as that, our hospitals anyway were absolutely full at the time because it was the peak time of the virus. People were on ventilators, people were dying. It was very serious, and that's something that I want to get across. It is very real. I mean, even I and my friends used to say, do you really think it's real? Do you think it's just a myth? But then I am like a fit 20-year-old, and it completely made me feel so ill for 7 days. Took another 2 weeks to recover. If it can do that to me, I was very lucky. I can't imagine what it could do to anyone else. It could definitely be fatal, and the deaths have showed that.
So you said you didn't go to hospital. How did you manage the situation? Did you take any medication at home?
No, I didn't take any medication. However, on I think the 5th day, so towards the end after the sickness and diarrhea, I was still very poorly. But on the 5th day, I actually had an awful pain in my lower back. I had terrible aches and pains throughout, but this was like a stabbing pain in the bottom right-hand side of my back. And we were worried because obviously the immune system was fighting this virus. And I thought, oh, it might be a kidney infection. So I rang the National Health Service over here and they said, oh, do you want to come into a Covid-19, like a centre, not really a hospital, I'm not sure, somewhere to get some tests done. But I was so weak and I was so tired. I just said, if you can prescribe me antibiotics if it is a kidney infection, because I feel like I'm unable to leave the house and go to a COVID centre to get tests done. I was just exhausted. So I then got referred to a doctor over the phone and they prescribed me with antibiotics straight away. And I had to get a family member from outside the household to pick these up and drop them off at my house. And then I started feeling a little bit better. So
Hannah, what was the reaction at home when you realized that COVID-19 had now come into the household, into your home?
So at first we were just very concerned about my dad, because he has underlying health conditions. In 2012, he suffered a stroke. He has high blood pressure. So we were very worried about him. But surprisingly, he was actually, not completely fine, but a lot better than what me and my mum were. And we are the ones who are fit and healthy. So at first we were very concerned about my dad. But then it felt inevitable to us that we were going to get it, me and my mum, because obviously we're in the same household, we're sharing food, sitting around each other. We knew, and trust me, it spreads so fast and so easily. And we got it straight away after my dad first contracted it from the nursing home that he works at.
So how soon was your dad able to resume his work?
I think he went back 2 weeks after having the virus, just to ensure that it was completely clear, because you do have to self-quarantine for 14 days if you have symptoms or if people in your household have it. And obviously with him working with elderly people, they're very vulnerable. So we wanted to, make sure that he wasn't putting anyone at risk. So it took him 2 weeks. But like I say, he didn't suffer the virus as badly as me and my mum did. So he felt fit enough to go back to work after the 2 weeks.
So this virus manifests itself in different, maybe even strange ways, because your dad, who has underlying symptoms, you get much more severe. You all get different symptoms, especially for you and your dad.
Yeah, 100%. That we couldn't believe it, because he was our main concern. Because prior to his nursing home contracting the virus, the nursing home that he works at, we actually all self-quarantined 14 days prior to this, because he had to stay off work for a little bit in case he contracted it, because we were very worried about him with his health conditions. Right. And then the place that my dad works at, they didn't have coronavirus in those 2 weeks. So he went back to work. The day he went back to work, somebody tested positive the day after. So obviously corona was in the nursing home at the time. Right. And he was just unlucky and picked it up at that time.
Okay. Hannah, thank you very much indeed for sharing your story, but stay on the line for us for a moment. Let me cross over to Dr. Sue Adongo. Good morning and welcome to Your World. Hello, can you hear me? For some reason, I can't hear you. We'll come back to you, Sue Adongo. Let me turn to Margaret Nje here. You are a clinical psychologist from the Technical University of Kenya. And even before we go into COVID, mental health is a huge issue at the moment. What's been your experience of it in this season?
Good morning, Joseph. It's a pleasure to have me here this morning. Mental health issues are real right now for a number of reasons. You're talking about the anxiety surrounding COVID the issues of stigma and discrimination that we are seeing also surrounding COVID. You're talking about issues of people who have lost their jobs, their livelihood. We are seeing the disruption in the education system. We are seeing the disruption in our normal day-to-day. Like you said, we are getting in. We are learning to live in the normal now, the new normal that we are in. And anytime people and societies are going through unprecedented changes, then you will see a lot of resistance, first and foremost. You also see a lot of struggle trying to fit in. And it's sometimes difficult for some people and for some populations, different ages, to try and adjust very well into the changes that we are seeing. So multiple losses, and when someone is going through multiple losses, then that tends to impact on them differently. Some of them, it hits them much more harder than other people. And especially if you don't have the social support system that you need. And one of the other things that COVID has done is ensured it's not just physical distancing, but there is also a bit of social isolation. Right. Because we get our support system from just being with people and being with family. And now that we can't be with people and we cannot be with family, so you're left in your own small world.
And talking about, COVID in the family, I mean, Hannah's just been sharing there how they had to rally together as a family to support one another. When it lands in a family, I mean, it's pretty difficult, even sort of mentally, the concerns, the anxiety and so on.
It's when it lands in a family, it's going to hit different family members differently. First, what does it mean when one of us has tested COVID positive? What does that just mean in itself? So we start from there. Are we scared? Are we feeling really, really threatened? Are we looking at it and thinking, this is death? Is our interpretation death or the end of it and the end of this family? Number two, what does it mean in terms of if we have all to go into isolation? So then again, there's a bit of disruption in that as well. Luckily, the ministry now is implementing the home-based care where we can all sit together, be together at home, like what Hannah and her family did. So that again is really good in the sense that we will go through it together. We are going to be isolated as a family together. What does it mean when our neighbors know that one of us has tested positive, and we have all these ambulances coming to pick us up, every one of us in a different ambulance. Yes. And so the neighbors now, they start from the point of it's that family of COVID.
And stigma, therefore.
And stigma right there. Yes. It kicks in right there. Okay. Imagine the family where you have children, and so the mother tests positive, your child luckily is negative, and this is less than a year-old child. And what does that mean? The mother cannot continue to nurse the baby. So they're separated. So it hits in different ways.
It's quite a lot of,
And, disruption from all different angles. And the thing about it, you didn't expect. It just happens. It's just one instant, and the entire family has to go through everything.
Let me, for a moment, Hannah, let me come back to you briefly. As you were at home recovering, what was your state of mind? What was going on through your mind? Obviously, this is a very new experience that you probably hadn't encountered. What was going on in your mind?
I was honestly just more concerned about my family members. I knew that my dad was okay because he had very minor symptoms, like I said. However, my mum, she was in the same sort of state as me, but obviously with her being older, I thought, could this be fatal? Could this be life-threatening? It's the unknown of the whole situation, because of the fact people have different symptoms, different reactions to the virus. You never actually know the outcome. It's never confirmed until you're completely over it. So it was quite anxiety triggering.
Okay, just with us again. Let me try Dr. Sue Odongo again. Good morning.
Good morning, Joseph. Can you hear me now?
Yes, I can hear you very clearly. Welcome to your world.
Thank you.
Now, you have been attending to expectant mothers in this very difficult season. What's that experience been like?
It has been an interesting experience. In the beginning, when we started, it was quite scary. Because as you know, we work in with different rotas, so you're put on a timetable on how you're supposed to work. And when I found out that I was going to be working with the COVID positive mothers and COVID suspects, initially I was scared, naturally. But with time and as time has gone by, I've become actually quite accustomed to it. It has been interesting interacting with pregnant mothers. We have challenging days, some of the days. Most of the patients we've been seeing have been asymptomatic. So you can imagine you have admitted some pregnant mothers, they have tested COVID positive, they're in the hospital, and they have no symptoms. And every single day that you go to see them, they ask the same question: are you sure? Can you repeat the test? Is my baby okay? But I'm not sick, you know, I'm not on any form of medication. I'm just sitting here. I can't get any visitors. I can't leave. I can't interact with the patient next to me. So it was an interesting experience to go through with these patients.
So let me ask, when you go to help deliver a baby from someone that you know is COVID positive, what is involved? What is the process like, even in terms of how you protect yourself, protect the baby and the mother? What do you have to go through in terms of a procedure?
Wow, it's interesting you asked that, because we actually delivered a mother quite recently, about 2 weeks ago. And you have to put on the whole hazmat suit, and it's very hot in there. So you can imagine you're conducting a delivery, whether a cesarean section or a normal delivery on a mother. You have to ensure first and foremost that you're wearing the proper PPE that is available. And you cannot rush through a delivery. It's not something that you can say, oh, in 5 minutes this baby will be out, in 10 minutes this baby will be out. So you go with it as you take it as it comes, and you end up, it's not a controlled sort of setting, you know. So you're sweating in there, you're trying to encourage the mother to push. The mother herself is in a mask. It was such a new experience, yeah. Having a baby coming into the world, we have procedures we're supposed to do for this patient, or you're doing a cesarean section for this patient. There are lights in theater bearing down on you. You're sweating buckets in there. The first time it was quite something, but we've slowly gotten used to it. We've slowly gotten used to working in the hazmat suit.
So what happens to the mother? She's COVID positive. She's delivered a baby. The baby is okay. How is the process of helping her recovery?
Well, first and foremost, even as with the mothers, before they go into labor, we do a lot of counseling for them. And for the mothers who are stable, they're COVID positive, but they're stable or they're asymptomatic, we still have to take them through the hygiene practices, washing their hands, ensuring they're cleaning their breasts before they breastfeed. And they have to do this with a mask. Of course, they are very anxious. They feel, oh, I might infect my baby. But so far, we've not seen any studies that have shown us that the mother can pass the virus through breastfeeding. So we do encourage them to breastfeed. We do encourage them to still stay with their babies as long as they are well protected, they are maintaining hygiene, and they are fully masked. The only difference we have now is, as you know, in our community generally, when people deliver, visitors come to see you, people bring you food from outside. Now, the unfortunate thing is we have none of that. It's such a lonely experience. You have delivered this new baby, but you're still in isolation with this baby. You know, there is no one, even the father of the baby cannot come in. We have seen them go through different stages of anxiety and isolation.
It must be really difficult for a mother to go through this process of delivering a baby with a mask on.
Oh yeah, it is. At some point, like there's once we delivered a young girl, and you know, at some point, labor, you can't control. It's not a controlled, like I said, environment. So after some time, she just took off her mask because she's trying to bear down to deliver this baby, and you know the way you need to breathe, breathing techniques and everything. So it is challenging even for the patient, and it's challenging for us, and we can't by all means force a mask on them. So we also have to ensure we are well protected and well covered, even as we're trying to attend to these patients.
Now, elsewhere in the world, we've seen reports of newborn babies who have tested COVID positive. Any such incidents?
So far, not that I have heard of. So far, we have not had any instances.
Okay, and so in terms, and sorry, I also have to ask you this: have you lost anyone in the process?
Personally, no.
In your work?
I have colleagues who have, but personally, from COVID-19, no. In my work, I have not. Remember, for me, most of my patients have been asymptomatic. Most of the patients I have attended to.
Okay. Dr. Dongo, stay on the line for us. Thank you very much indeed. Let me cross over to Saya Zaland. Good morning and welcome to your world.
Good morning to you and all the viewers who are watching us now.
Okay, thanks a lot for joining us. Please share your experience. What was the experience like for you when you contracted the virus?
Generally, when I got the virus, I was in the area that it was isolation area, and there were too many people positive around me. I was very surprised. I had mask. I had washed my hands every day, every an hour. But still, I got the virus, and I was when I got tested, I was positive. During my first 5 days, it was very hard for me. I had breathing problem. I had a cough. I had fever. And I had some pain in my back. So this was the first 5 days, but I had advices from the doctors, from my healthcare person, how to handle the situation and how to compete the virus. After 5 days, I got better day by day, and after 15 days, when we did this again, I was negative.
So you did not have to go to hospital? You were just at home?
Yeah, normally I was quarantined at home because I was in the hospital for some days because I had breathing problem in the first 5 days. But after 5 days, when I was recovering, I was quarantined at home and just following the advices from the doctor and my healthcare person to what to eat, like which kind of food, with drinks and etc. like that.
So what kind of food were you eating? What was your diet?
Normally, I was eating the fresh diet, like from the not meat, or only like I was eating fruit mostly for almost 20 days, and still I'm eating that. With water, with salt and lemon. That was like my daily routine today.
Okay, Zalan, thank you, but stay on the line for us for a moment. Hannah, let me come back to you just before we will let you go. So how's your life at the moment? I mean, there are concerns there may be a second wave in the UK. Do you get worried?
I do get worried, actually, because even when it was at its peak, I could see people on social media going out, not wearing masks, socialising, which was actually illegal at the time. However, pubs and bars, restaurants are all opening this Saturday over in the UK, and that really concerns me, because that leads to the worry of the second wave happening. And our National Health Service have worked tirelessly, and we've only just started to get over it. I think that opening things now may be a bit too soon.
And so finally, Hannah, when you hear people say this thing is not as serious as they say it is, it doesn't really exist, it's not a huge problem, what do you say?
It is serious, trust me. I mean, I was very lucky. I had it completely minor, but I know that people have died from it. People who are in nursing homes, old people and young people too. So coronavirus doesn't discriminate who you are, how old you are, what health conditions you have. Yes, if you have underlying health conditions or you're elderly, you are probably more vulnerable. However, you just never know. There is not enough research that has been done yet. You don't know if you can get it again. I mean, I'm still being careful. Obviously, I've already had it, and it's likely if I got it again that I would probably just have the same symptoms, or maybe have it even a bit easier than I previously did.
Okay.
But who's to say that I can't get it again and then pass it on to someone else? It's a vicious circle, and I could pass it on to somebody else who could have it fatally, and that's what the fear is.
Okay. Hannah Thompson, thank you very much indeed for sparing the time to speak to us this morning, and have a good day.
No problem. Thank you. Thanks. Bye.
Bye. Thank you. Now, 19-year-old Matt Grinches from Okotoks in Alberta is one of the youngest survivors of the disease in Canada. Donna Friesen talks to Grinches about the fight with COVID-19, when he got sick and how quickly he deteriorated. Grinches wanted to go public with his story as a message to young people that they need to pay attention to this illness and not assume you won't get sick.
My mom had to wake me up and break the news that she had to leave in 5 minutes. And so that was definitely the hardest point mentally for me, just knowing that I couldn't see anyone that I knew in probably the scariest time of my whole life. And yeah, you know, just like, and the nurses too. I give my heart out to the nurse who had to give that news. You know, it's just as hard for her to see that happen as it is for us to take it. And yeah, it was really tough. And I had never expected at all. Like, my tonsils and everything was swollen to the point where I couldn't communicate, I couldn't breathe properly, and I couldn't swallow. And so those three things alone are enough to scare. Like, it was terrifying for me. And being so young, you know, I never expected to be in that sort of a spot where I would need to be in intensive care. And so I guess it's a good takeaway to know that this really could happen to anyone. Being at university and living on campus, it's such a diverse and international place that I must have just touched the wrong doorknob or something, just a freak thing that I'd never expected. I was aware of some people who were having small house parties and gathering still, like, around people that I know. And you know, it's tough for me to see that, knowing what I went through, and I don't want anyone else to have to go through that. So I decided to come out publicly with what happened to me to hopefully raise awareness more of my peers and say, you know, I don't know how I got it, and it could really happen to anyone. I was thinking, you know, I'm just going to get over it. It's just a sickness. Like, I'm young, I'm healthy. But being wheeled down to the ICU and being in those remote hallways where there's nobody, I was with my thoughts and I was thinking, you know, this is kind of like, this is scary now. And then while I was in ICU and all of my symptoms just exploded and peaked, and how much care I was being given, I was finally thinking, like, you know, I don't know how this is going to turn out. I don't know how this is going to end up. So that was definitely a very scary moment for me to think that.
Matt, you're looking great now. You're talking to us. What's your prognosis? How are you doing?
I'm doing much better now. I've had a lot of time to recover at home now. I've just been basically sleeping away the days, trying to get better as much as I can. But yeah, definitely better than it was.
So, Dr. Dongo, back to you now. I wonder when you have attended to pregnant mothers who have tested positive, what kind of care is involved for a mother who's delivered, but she also still has to deal with this new condition?
Sorry, I didn't get the last part of your question.
Yeah, just wondering the kind of care involved for mothers who are COVID positive and are just delivered. What kind of care is involved for them?
We still give the same care that we would give any other mother. And remember, these are mothers who largely are showing no symptoms. Okay, so the most we do for them is keep educating them on how to care for themselves to prevent them from passing on the infection to their children. But essentially, we still give them the same care that we would give any other mother who has delivered. And we stick to the infection prevention practices that we have been preaching.
Now, you and your husband are both doctors. So I wonder what goes on when you know you're stepping into a potentially difficult environment and having to go back home to your children. What's your life like?
Thankfully, he is currently not placed in a place where he is actually treating or managing confirmed COVID positive patients. But of course, we know that anytime we go to work, it's like going to war, for example. You do not know whether you might get exposed or not. And initially, it was a thorn, it was a point of anxiety. But now, this is what we do. This is life. It's something that we swore to do. Of course, when you're there saying the Hippocratic Oath, you're not thinking, oh, one day there'll come a time when there's a pandemic and I'll have to go out and risk myself. But we've come to a place of acceptance that this is what we have to do, and we just take extra precaution with ourselves. Of course, we try not to work at the same time, so that at one point or another, one of us is at home with the kids. And yeah. And
back to mothers and children, do we know as yet whether there is any link, any evidence of mother-to-child transmission of COVID-19?
Currently, we don't have any local studies yet, but when we lean on studies that have been done elsewhere, there's currently limited evidence showing that there's any transmission of the virus while the baby is in utero. So we don't have any evidence linking to that as yet. No, we don't have any proof of that.
Okay. Stay with us for a moment. Now, Margaret, just going back to young people again, or not just young people, but even the general population, a lot of people still don't think that COVID is real. What is it in the human psyche that, we know that that situation is dangerous. We've been told it's dangerous. We've seen people die. We've seen people fall seriously ill, and we still will not take precautions or take the situation seriously. What's up with that on our minds?
It's interesting to just sit here and listen to people who have gone through it, share their experiences and what it meant for them, and the innate fight they had to fight, to come up. and just get the courage to come and share their experiences in a world where COVID-19 positive test is surrounded by a lot of stigma. A couple of things, Joseph, come to mind. One, if it hasn't happened to me and to someone that I know closely, then it's not happening. There are people who, with just that mindset. I haven't seen anyone that I know. I haven't heard of anyone that I know. Number two, I think the biggest challenge with just trying to communicate the message about COVID-19 is the fact that almost everyone getting tested is at a asymptomatic phase. I think we are so accustomed to seeing people really, really sick. But the fact that you don't look sick, you're in hospital, you're not getting any medication except maybe supplementation of vitamins. I think it would take a bit of time to tell people that even though you don't have the symptoms that you expect and that you and I expect, there's still a risk. So there's quite a bit of work to be done in terms of behavior change communication. And we really need the expert in behavior change communication to come and package this information and send it in a way that people will understand it. Because if they don't see it, if they don't know anyone, if it is just, we are hearing about it, if the people, we are seeing interesting clips of people in the quarantine isolation centers and, doing all manner of things. So then again, when you read, you see like, these guys are not sick, so what are they doing there? Right. But it's real. I mean, like they're saying, it is real. So there's that aspect of, I'm not sick, I haven't had one of my own who is sick. However, that's just from a point of taking it a bit casually. Then there's also the other thing of, there's a way we try to minimize intellectually the impact of something, because we don't want to take it in with the intensity and with the seriousness it deserves. Because when I acknowledge that this thing is real and it is this serious, then it's disabling for me. And I don't want to get to the place of feeling overwhelmed by the reality of what is going on. So I would rather mentally just intellectualize it and just treat it in a very casual manner, right, because it helps me cope in the temporary.
Okay. Yeah. Zalan, let me come back to you. In Germany, are people taking this COVID-19 situation seriously?
Yeah, the people are very supportive here, and everyone, they are following the rules and the regulation and the restriction which are advised by the government and by the healthcare organizations. Especially the mask in the public areas, in the public transport, in the supermarkets, and also in the office, and the social distance. These are the main important points which are following by the people here in Germany, and everyone is following. Like when I'm going outside, I have to wear the mask. I have to be patient with the people and not go near to the people, at least 1.5 meters. So these people are very, very patient with the sickness or illness, and especially with the COVID-19. Everyone is supportive to the government, everyone is supportive to each other, and everyone is taking care of their health and other health. This is why normally since last 2 weeks the life goes normally to the normal life. And maybe in the next few weeks, there will be no positive case in Germany.
And so for you, Zalan, once you recovered, did it change your behavior in any way after you were now fully recovered?
Yeah.
Sorry, I think we've lost that connection. We hope we can connect back to Zalan soon, but we'll take a short break and then we'll come back with your word. But first, here are some of your comments that you've been interacting with us on our hashtag New Normal. We asked you, do you think COVID-19 is real, and are people still taking it seriously? This is what you said to us. I don't. Why? Only poor people are restricted from gathering while politicians and the rich aren't. Is the disease selective? This is from Alfax. Remedial measures are used punitively. Law enforcers will threaten you with quarantine, not to save you, but so that you can bribe them. Okay? And another comment here. This one is from Gadoni Karaoke. Wait until your loved ones get infected. That is when most of us will see the reality of COVID-19. Stay safe, people. Regret is the worst thing you would wish on yourself. Thank you, Gadoni, for that. This is Louise. You say, no, it's not real. Do you have a friend or relative with COVID-19? Okay, thanks for that. And this is Naomi. You're saying it's real, but we're not too sure how much it's spreading here in our country. All right, another comment from Wanyama Jomo, nothing like COVID-19 in Kenya. These guys are just making dollars through this pandemic. Okay. Sunguti, you say it's just business that's being perpetrated around. Okay, so you also believe it's not real. And then Sherry, well, it's real, but as Kenyans, exaggeration is too much and corona. Okay. Another comment from Jemot Njoro. Well, since it started, I've never heard of anyone who is positive or someone who knows someone who's positive. So I'm confused. Jomo. Then Hamdish Isa Adan Ade, we used to take it seriously in the first weeks. But after the exaggeration from the government, we're not scared, just normal. We even hug and greet each other. Hiya. Sami Nganga. It's dependent on the donations. The more the donations, the more real it becomes. Okay. Ominde Tito, COVID-19 is real and is here to stay with us. My advice would be let our community own the Wuhan pandemic, COVID-19, and not government-led. And Zamza Mohammed, you say Corona is real. I lost my uncle in the UK due to the virus, but in Kenya, it's a business. Let them continue with the charade until the real disaster strikes. And this is from Fredo Mondi. COVID-19 is a virus that has brought tension globally. Let's not talk as if we're not seeing what's happening to other nations. Okay, Zalan, let me come back to you. We lost the connection to you, but I think we can see you and hear you. So welcome back.
Yeah.
I was just asking you, after you recovered, did it change your behavior in any way?
Yeah, I said before that when I recover, still I have something in my body that I feel it like I have a headache sometime. I need to drink more water or any juice, and also sometime I got angry very soon. That was not with me in before, because I was very calm and very normal. But nowadays, after the COVID-19, I am got hungry sometime. Maybe that's the infection of the virus to me, but I'm normal now, and I have no other anything that I should say.
Okay, do you get worried sometimes?
Yeah, I was worried in the first few days that what I said, because I was new in Germany. It is my almost first year here in Germany, and I was new here, and the virus came to me. So I was very worried, because I'm away from the family, I'm away from everyone. They're back in Afghanistan. I was too much worried. But after the first week of the illness, when I got recovered and my healthcare person told me that you're going to be well and not worried, then I started to follow all the advices they were giving to me.
Okay, well, Zalan, thank you very much indeed for joining us this morning and sharing your experiences from Germany.
Thank you so much.
Have a good day and stay safe. Thanks a lot.
Thank you.
Dr. Adongo, let me come back to you. As just before we also let you go, what would you say are some of the biggest challenges of working in the environment that you do and continuing to help mothers who need to see their newborn babies?
There are several. One, this whole virus is new. It keeps evolving. So dealing with something that is unknown is a challenge. You don't know what new thing is going to come up. And because of that, it brings a bit of anxiety with it. Another challenge is stigma, of course. Even being on this show might get me stigmatized. But, you know, the people who know that you work in those wards, even your colleagues, you know, they make jokes like, you know, don't come near me, put on your mask, have you washed your hands? So there's that kind of stigma that comes with it. You almost, you know, just don't want to say that you have been assigned to work with COVID-positive mothers. And of course, having the issue of you're dealing with people who are in hospital, but they're showing no symptoms. That's a new thing. So how do you exactly tell this person who themselves, they don't believe they are ill? A test has been done, it's saying they're positive. You're working with them every day and they keep asking you, why can't I just go home? Patients amongst themselves also stigmatize each other because you have asymptomatic patients stigmatizing symptomatic patients. You know, you're coughing, don't come near me. You might, you know, I might get your corona. So those are some of the challenges we go through, learning new things every day, evolving, and also just the fear of getting infected. It's a real fear, and infecting your loved ones, your children, the people who you live with in your house. Yeah, those are some of the challenges that
how do you deal?
We go through.
How do you deal with stigma?
How do you deal with stigma? Well, really, okay. Personally, I try not to talk too much about what I do, and about what I face. We keep it in-house, most of the things that we go through. But we take it in stride because really it is what we do, we have to do it. So it's just something that we take in stride.
Okay. Dr. Sue Adongo, thank you very much. Thank you so much for joining us this morning. All the best, and thank you for helping us to bring on board new Kenyans.
Thank you so much. Thank you for having me, Joseph.
Okay, Santa, stay safe. Margaret, stigma. It's a big issue now. There was actually one person who was supposed to join us from Mombasa, and at the last minute they said, no, I'm facing a lot of harassment because of where I work, and so I feel I don't want to talk, even though they'd agreed to. So stigma is real, and it's a big issue.
Stigma is real. It's very anxiety provoking for anyone working in a COVID context right now. The first lot of people who are put in government mandatory quarantine, I volunteered as a psychologist in one of the centers, and stigma is real. The fact that people knew I'm driving into that compound every morning and driving out every evening, and I was there for about 21 days. It was real, and at some point as a psychologist, I was so overwhelmed by the things that I was dealing with on a day-to-day basis. Just offering the psychosocial support to the people in quarantine and to the rest of the staff who we were seconded to the quarantine center, and so, like even reaching out to a psychologist and says, hey, I need to meet you. I am, I feel like I'm at the point where tipping point and I need supervision, I need support. And the first response was like, but I don't want to meet you. You could, also infect me. And for me, that's when it hit me that as long as you're in that context of the COVID-19 context, you're also treated with a lot of suspect. and with a lot of suspicion, and no one wants to get near you. So stigma is real. Stigma is real in the sense that we use words. Because you can stigmatize using words and an attitude, you discriminate using actions. And like the language we use towards people who have tested positive is very stigmatizing. When you say that COVID person, I mean, there's the individual respectfully, and he just happened to have contracted a virus.
So you strip away their identity, they become uyumtu wa corona.
They become uyumtu wa corona. So you just, strip it off them, and you don't see this person beyond the virus.
Okay.
And as we are talking about stigma, let's just remember this virus does not discriminate. It's not a respecter of position,
anybody
of race.
Anybody can.
Yes, anybody can get it.
Okay.
It doesn't.
Let me pause it for a moment, just to cross to Nigeria to Lucy Oswizibo Okechuku. Good morning.
Good morning.
Thank you and welcome to your world. Now, what's your experience with COVID-19, Lucy?
I will say COVID-19 actually hits me with a fear of death. Because if anybody had told me that I would get the disease, I would not believe it, because I am a journalist and I write health, and I try to adhere to all those precautions in every way. I tried, but I didn't believe it when my result tested positive. So it actually hit me with a fear of death, and it changed a lot of things about me.
What was your reaction when those results were confirmed?
I became suddenly depressed. I became unhappy, full of anxiety. I didn't even want to talk to people because of stigma. I didn't know whom to call. All I did was call back the number and ask, "Are you actually saying that I tested positive?" And they said, "Yes, just pack your bags. We're coming home to pick you to the center where you'll get treatment." The first 4 days, I was just an unhappy person. I was not talking with anybody. I was quiet all the time because it was confusing, and I tried to understand what was going on. So it was not the best period of my life at all. It wasn't.
What kind of symptoms did you have?
Okay, I had slight sore throat, a pounding headache. I had fever. At night, I feel feverish, and I was feeling extremely tired. I went to the hospital and I was tested. They said it was malaria. But when I started the malaria medication for like 3 days, I lost my sense of smell and taste. I was cooking, I was eating, everything became tasteless, odorless. That was when I became scared. I went back to the hospital. The doctor was trying to put me on another medication that maybe I grew resistant to the malaria drug. And after some time I was waiting, he came back and told me, "Go and do a COVID test." I didn't want to hear him. I said, "Do what?" He said, "Do a COVID test, please."
And so
I
when
didn't call the first. I didn't call the center the second day, the center where we're supposed to go, the emergency health center. Until like the third day, I now called. They asked me what my symptoms were. I told them. And then they didn't take me serious the first call. I called again and they said, okay, if I could come around, they would do the test. So I did. Even at the point of doing the test, I hear people talk about they go for tests. But when I saw how they did it, it was not a big deal, because I used to think when they insert that thing inside your throat and your nose, I thought it was a big deal or scary stuff. But I saw that it was not. And I was like, I don't think this should be a big deal. For sure, it's going to be a negative result. So I zeroed my mind, but they told me to go home and self-isolate or get quarantine myself until the result comes out 48 hours later. That was on a Thursday. On Friday, On Saturday, I didn't get a call at all throughout Saturday. So I went about my normal life until Sunday morning when I got the call.
And so, Lucy, when you went to the facility, what was the treatment like? What was the experience there?
Oh, I would say it was near fantastic. Constant power supply, constant water. The environment was very clean. We had doctors coming around to do checks. They do, I think, blood pressure check. They do oxygen level check and check our vitals. The feeding, morning, afternoon, night, it was okay. And they have a way of trying to talk to us and answer all our questions to make us comfortable. I spent 10 days at the center, and it was okay.
Okay, Lucy, thank you. Stay on the line for us while I cross over to the UK to George Murara. Good morning and welcome to Your World.
Hi, good morning.
Now, George, you're a psychiatric nurse. Can you share your experience with Corona? What happened?
Well, very quickly, I contracted the virus from my colleague at work. He was looking after a patient with the COVID-19. Unfortunately, the patient passed away, and my colleague was ill for about a week after that. But I was ill for about 4 weeks, and the first week was light. It is a feeling of fatigue, it is a feeling of slight sore throat, a little bit of temperature, and gradually all those symptoms became more and more severe. And eventually I was in bed throughout. The first initial feeling is you just want to lay in bed for a little while and rest. And then you realize your joints are going, they're starting to ache, you're starting to shiver, you're sweating, your temperature is really, really high, but at the same time you're feeling very, very cold. And you begin to lose your appetite. And within no time, you lose your taste. And then you lose your sense of smell. And then you're gravely ill. It's, those people who've had malaria, now this is like 10 times more, the feeling. It's very heavy, it's disabling. And in my case, people have different presentations with their symptoms. It got to the point where if you want to go to the toilet, in my situation, and it's 8 p.m., I would finally make it to the toilet at around 4 in the morning. And that is because I was under pressure to go. And with no appetite, it's just basically passing water. You're drinking and it's coming out of your system. Yeah.
And so how did you, in terms of treatment, how did that go? And where did you get it from?
There is no treatment. So you're going to have to treat yourself. First, you have to be alone. There is no help. You're going to be isolated. And you have to have the spirit and the will to live. So if you haven't got that, you're going, basically. And it was one morning in the third week or second or third week when I got up to make a drink in the middle of the night, a lemon, which was the only drink I could have. And of course, porridge. I'm a native of Nyamira, so I was brought up on finger millet porridge. So that would go through. I would have 2 cups a day and lots of lemon and honey and ginger. So I got up in the middle of the night to go and make myself a lemon. And I collapsed in the kitchen. I had no energy. I felt so dizzy. I hadn't eaten for so long, and I collapsed. I came to about an hour or so later, and I realized that I now need help. have to get somebody to come and help me. And I called the emergency services. They turned up, and my temperature was 39, and they were concerned about the level of dehydration, and they took me in. So at the hospital, my local hospital where I lived, just slightly outside of London, there were over 200 COVID patients, most of them fighting for their lives. So I wasn't near that level, that crack home. So I was basically revived, given a chance to go home and survive a little longer. And there was no treatment. Treatment is what you have to do on your own, in your own privacy.
So when you go back to the house, how did you manage the situation till recovery?
I had to continue that way, and at this time, some of my friends got to realize that I'm in a very bad place. And
this guy is from London.
Hi, I think the broadcast has been disrupted. My friend from Nigeria. Hi. Good morning.
Sorry, you can go on, John. Lucy's still on the line. She cut across your conversation, but we can hear you.
I'm sorry.
Yeah.
No problem.
In the third week, my friends began to realize that I needed help, and they would drop food, mainly ready-made, porridge and fruits by the door, and I would go there and pick them and eat. And I would just eat a fraction of the food because it was not possible to eat everything. The porridge was useful. It made it a lot easier for me because I couldn't make porridge at this time. I needed somebody to do it for me. And a porridge in a thermos, I would have that for morning and evening. And then I would manage with my fluids, lemon, ginger, and garlic, and all that. Okay. So that is how I survived. And gradually, I began to get better in the third week. And I wouldn't have done that without, of course, my faith, prayer, having a positive attitude, knowing that you haven't accomplished your mission on the planet, really, really persistent prayer. And I've got good friends. They were praying for me. Some were fasting. So
George, you were praying and you're doing all these things. At any one time, did it cross your mind that this could be it?
Of course it did. I mean, my breathing got so bad. It was so shallow. I felt like I'm contained in a place without oxygen, and my energy levels were so depleted. I knew that this is it. I am going. But, I was praying. I've got little kids. I want to see them grow. And I've got things I want to do and accomplish. And I said, dear Lord, you've got to help me. You really got to help me. And I helped.
And your other family away from the UK, did they know? Were they concerned?
Oh, my mother called me every day. I couldn't pick most of her calls, but she called every single day, sometimes 2 or 3 times a day. I have friends and family in the US as well. I have a cousin, and he could not let me go off the line until I had finished what he had ordered me to make. Porridge or drink, he would make sure I have drank it. If I didn't drink it, he was on video call. If I didn't finish it, he wouldn't end the call. And so this is the way I survived, because you have no appetite, you have no will.
Okay, George, thank you. Stay on the line for us. Let me come back to you in a moment, George, while I go back to Nigeria. Lucy, what kind of support did you get from family and friends?
I didn't tell, except for my siblings and my boss at work. I didn't actually tell people about it. Even my parents, I didn't tell them for fear of stigma. And I wanted to understand what I was dealing with. But my siblings were calling every day.
And now
to check on me. They were doing video calls. They just wanted to see me.
Now, Lucy, George there was talking about relying on the power of prayer and friends. What is it that kept you going? Okay.
I tried to keep a positive mind. We were in a world where we were 12. It's a 12-bed space. There are other people there. So every morning we pray. And there's this particular guy who happens to be like an evangelist. So we try to pray. We share our experiences. We talk to each other. And because we talk and we share our experiences and we give ourselves... It was very soothing that there was hope. And again, there are people who come around to see people. So we just look at them and talk with them through the window, and they try to give us message of hope. They try to preach to us, and then it kept us going. it did.
And so what kind of foods were you eating as you were recovering?
More of vegetables and fruits. More of vegetables and fruits. Even after recovery now, I try to eat more afternoon for breakfast, for lunch, for dinner. There has to be vegetables. In the afternoon, a snack on fruit. I do that because the doctors actually advised us that there is no cure, but with good diet, we could have our immune system boosted to fight whatever infection. So I do more fruit and vegetables.
Okay, and now, Lucy, before you go, now that you are recovered, what's your state of mind? Do you get worried? Do you get concerned?
Because here in Nigeria, many people still believe it is not real. Sometimes when I go out, I see people still go up. People don't wear face masks. Even when you try to tell them, this is real, they laugh at you, they think you're making it up. And I'm scared for people. Really, I am scared because this is something, people are dying. And I tried, that was why I said, okay, I'll try to be an advocate of a disease that is killing our people. Let me see the few people I could talk to, whom I could convert, whom I could convince. It is real. So my attitude right now is I'm scared for people. I am really scared.
Okay. Lucy, thank you very much indeed for joining us from Nigeria to share your experience of COVID-19. Have a good day and stay safe.
Thank you very much. Have a good day too.
Okay. George, back to the UK. So you're now fully recovered. When you look back at COVID-19 and that period of, what words would you use to describe the situation you were in before?
I basically was dying and I came back from the grave, and I'm grateful for my life. And I take life very, very seriously. Life is precious. I have lost a colleague at work. It's extremely difficult for the family. And in the county where I live, more than 1,000 people have died from COVID. So it's a very, very serious thing. And for me, looking at Nairobi and seeing when the lockdown came into place and people trying to sneak out to travel up country to their loved ones, Nairobi is a metropolitan with lots of people coming from different parts of the world. And you don't know who's brought in the virus. And the virus does not present itself in a manner that you can say. It can be somebody perfectly looking healthy who will pass it on to you. Then you go to your grandparents at home who've got compromised immunity and you kill them.
Okay.
When the government says stay in Nairobi, please stay in Nairobi. I know life is hard, especially in our country. But stay in Nairobi, protect your family and your loved ones. It's serious. COVID is real.
George Morara, thank you very much indeed. Asante sana for joining us from the UK. We wish you a good day. Now, all the best. Stay safe. Asante sana.
Thank you so much. Thank you so much. Greetings from the United Kingdom.
Asante. Okay, so we'll take a short break. But just before we do that, I see more of your comments coming in. We asked you whether COVID is real. And Nabuire says, well, we're so tired. I mean, tired emotionally and physically. These everyday questions are not helping us anymore. Asante Nabuire. Bravo Kilo Mike, you say, well, in Kenya, we have types of COVID-19, one that kills the poor and the other that is immune to deep state and establishment. Okay, bado kuna siasa kwa COVID. Agnes Shege, it is real, but mild in Kenya. Life goes on, but wear a mask, wash hands, and keep the social distance. Thank you so much. Imelda Mwanga, you say, COVID-19 is real. It exists even in Kenya. However, I lost my confidence in Ministry of Health. I highly doubt their sincerity. Okay, you should give us reasons for that. Maina Patrick, Corona is a great business investment for the big fish in Kenya. Okay, so people still skeptical, some of them. Augustine Mudenji, you say Corona is real, though there is a lot of misinformation on the pandemic. All right, and this one is from Hannah Kamoyo. You say Corona is real, but Kenya has a bigger problem than Corona. Okay, now the first pregnant woman in Liberia to test positive for coronavirus has given birth to a healthy baby girl. Sedia Marwolo, a nurse, became COVID-19 positive at work and was transferred to a coronavirus intensive care unit in a military hospital east of the capital, Monrovia. Having recovered from the virus, she returned to give birth to a baby girl. Her husband and one of her 3 children also contracted the virus and recovered. But after surviving the ordeal, Marwolo says her family now face the stigma of having had a brush with COVID-19. Liberia has recorded 250 coronavirus cases to date, with 24 people who've passed on.
When I was taken at the treatment center on April 15, my greatest fear was my baby in my stomach, because it came a time I could not even feel the movement, because I knew very well that my baby had been very active. There was no OB doctor, no midwife, nothing was at the treatment center to even check me with my condition. Being in this community right now, I don't feel like being here, because people are just passing, staring at all. We even hearing that they are calling our horse the corona horse. Sometimes when you come in, you see some people running because they don't want to stay in the corona yard.
I thank God I'm happy, because every one of us that they took from here, we came back home safely, including the baby now in the stomach. So I'm very much happy.
Okay, that's the experience of a family in Liberia. We'll also be connecting shortly to a family in Mombasa. We are also joined on the line by Professor Julius Oyugi from the University of Nairobi, who is a virologist, to tell us a little bit more about the virus. And with me in the studio is a clinical psychologist, Margaret Njehia. First of all, let me go to Mombasa. Ernest Olo, habari asubuhi?
Mzuri sana.
Sawa, sasa naambiwa familia yako mmekumbana kidogo na huu ugonjwa wa corona. Ilikuwaje?
Bibi yangu ndiye alipatikana nao wa kwanza na wakapimwa hapo Feri. Sasa alipopimwa baada ya siku 3 akapigiwa simu asubuhi. Sasa alipopigiwa simu nikaambiwa amepatikana na ugonjwa, kwa hivyo atakuja kuchukuliwa. Nikasema ni sawa, lakini nilishituka sana kwa sababu hata mimi nilijua niko nao. Na watoto wangu pia nikajua wako nao, lakini nikasema sasa mimi naachia Mungu, manake sina uwezo wote. Kwa hivyo baada ya hiyo walikuja wakamchukua. Baada ya kumchukua mimi pia nilifikiria nitaenda naye, lakini wakaniambia watakuja kunifuata baadaye. Baada ya siku hiyo, siku ya pili wakaja wakanifuata. Nikapelekwa pale Likoni the Bland na watoto wangu. Sasa hapo tukapimwa, watoto wakapatikana wako negative, mimi nikapatikana niko nao.
Kwa hivyo wewe na mama mlionekana mko positive, mna maradhi?
Tukapelekwa Mombasa Polytechnic. Basi tumekaa huko mwezi mzima.
Na sasa Olo,
basi baada ya mwezi
kabla nani ya hospitali mlikuwa na dalili za aina gani wewe na mke wako?
Sisi hatukuwa na dalili yoyote, isipokuwa mke wangu kidogo ndiye alikuwa, manake kifua kama kumsumbua, lakini ilikuwa ni kama baada ya siku 2 tu, lakini akarudi sawa.
Kwa hiyo
na mimi
Naam. Sasa kwa hivyo mkapelekwa karantini, ilikuwaje huko?
Huko tulipopelekwa huko maisha ilikuwa si mazuri sana na si mabaya sana, manake tulikuwa tunapewa maji kwa siku chupa 3. Saa zingine tunalala njaa, na kama ni chakula tulikuwa tunaletewa chakula ile baridi. Yaani tulikuwa na mambo mengi, pia maji ya kuoga ni shida, sabuni hakuna. Sasa unaoga maji matupu.
Na kulikuwa na watu wengine huko?
Kulikuwa na shida, manake watu walikuwa ni wengi. Manake rumu yetu tulikuwa watu 14. Alafu mahali bibi yangu walikuwa karibu watu 30 na.
Na sasa
kulikuwa na matatizo mengi.
Wakati huo ulikuwa unajisikiaje mwili ukiwa karantini?
Mimi nilikuwa nasikia sawa tu, sikupata shida yoyote wala kupewa dawa yoyote ya kumeza kama pengine nasikia malaria, sikupata shida yoyote.
Na mama?
Mama ndiye alikuwa na shida kidogo, lakini baada ya siku 2 akawa sawa.
Sasa unasema kwa nini mlikaa huko mwezi mzima?
Mara ya kwanza tulikuja baada ya kupimwa mara 2-3, tukaambiwa tutoe shilingi 31,000. Sasa baada ya kuambiwa hivyo sisi tukasema hatuna. Manake hatuna kazi. Huyu bibi ndiye alikuwa akifanya kazi na pia kazi akawa amesimamisha. Sasa kuanzia hapo ndio naona basi masaibu yetu iliingia, kwa sababu sasa tukawa tukipimwa tunatoka positive. Tukipimwa positive. Tulipimwa mara 5.
Na hii
sasa hapo ndio
unaposema ilikuwa positive mara 5, hii ilikuwa ni matokeo ya kweli?
Sikuweza kuelewa kwa sababu tulikuwa tunapigiwa simu tu. Ilikuwa ni wewe mwenyewe upige simu ulize matokeo yako imetoka vipi, unaambiwa matokeo yako imetoka positive. Sasa tukawa hatuelewi kama imetoka sawa ama haijatoka sawa. Na pia wakati wa kutoka na daktari alitutembelea akatuambia, sasa nyinyi hamwezi kuambukiza mtu wala kuna yale maganda yako ndani, sasa ukipimwa uwezi kutoka negative. Sasa nikashangaa kama hii ugonjwa ilikuwa na maganda. Sasa sikuelewa sana mambo yao.
Sawa. Olo, subiri kidogo, nitarejea kwako dakika moja. Kwanza nizungumze na Professor Oyugi. Welcome to the program. Good morning, Prof.
Good morning. How are you this morning?
Very well, under the circumstances. Now, you are a resident virologist in this program. So, this virus is really getting out of control. There are places we're witnessing second wave in the UK and even in the US. In Kenya, we're yet to reach our peak. What causes these waves, and should we get used to the idea that it will come in waves?
The issue of second wave, to be honest, as far as COVID-19 is concerned, if the only countries that we can talk about second wave of COVID-19 are South Korea, China, Germany, and Italy. Now, these countries, they went through what we call a first wave. You know, the virus was able to spread in their countries. They implemented the total lockdown, and they were able to reduce the number of those who are infected to almost 0. And so that was a first wave. Now, so any other country in the world, if you talk about the US is still, they have never gotten out of the first wave. So we can't talk about second wave in the US. So the countries that I've mentioned, you know, there has been news about second wave, for example, in South Korea, because they have actually identified clusters of individuals who are actually testing positive for COVID-19. But again, even these clusters, you know, they can be identified, isolated, and you know, they don't spread the virus in the community. And as such, we cannot actually call that as a second wave. A second wave would occur if the virus now come back in the countries that I've mentioned, and you know, spread in the entire country, and then you have, you know, large numbers of people who are infected, like what we saw happening in the first wave. So when we talk about second wave, we have to be very careful on what we mean by second wave as far as COVID-19 is concerned.
So in the UK and in America, these are really fresh infections?
No, in the US, by the way, they have never gotten out of the first wave. You can see the numbers. There's no time. The numbers are increasing on daily basis. Each day we are seeing more and more new cases of COVID-19 in the US. So we cannot call it, you know, a second wave. What we have seen in the US, which is interesting, apart from second, you know, not seeing second wave, is that we are seeing more younger people in the US now getting infected with COVID-19. And, we are thinking as virologists, that may be a danger because younger people, the disease does not manifest in them the way it manifests in the older people. And therefore, they could be potential carriers of this virus from themselves to older people who will then actually end up with severe COVID condition and may need hospitalization and probably even actually die because of COVID-19.
Just briefly, what could be the reason for that, for more younger people getting infected?
I think the US, if you look at what has been happening in the US recently, they kind of opened up very soon. They implemented lockdown, but they opened up very soon. People were allowed to go to social gathering, places like bars, beaches. And, more people who socialize are younger people. So they are likely to, be in these places compared to the elderly people. But again, if you look at the US, what's happening now, wearing of masks, which is a very effective way of controlling the spread of COVID-19, is become like politicized. If you are a Republican, you're not supposed to wear masks. If you're a Democrat, you wear a mask. Now, if you have a population where a group of people are not wearing masks and another group is wearing masks, then you are actually creating an environment for the spread of COVID-19 within the communities.
Okay, Prof, thank you. Stay on the line for us. Wacha nirudi kwako tena Ernest hapo Mombasa. Sasa hivi hali yako na family mkoje?
Sasa hii sisi tunaendelea vizuri, tunashukuru Mungu. Hatuna shida yoyote. Shida ambayo tuko nayo tu ni ya matatizo ya kula, lakini kiafya tuko sawa.
Kwa hivyo nilipokuelewa ni kwamba mlipitia mateso ama hali ambayo kidogo ilikuwa ni ngumu hasa katika karantini.
Ilikuwa ni hali ngumu, manake ukiangalia kuoga, unaoga maji matupu. Hiyo chakula inakuja ni baridi na ni time ya inakaribia saa 4. Sasa yani ushalala ndio pengine mnaitwa sasa chakula kimekuja. Yani kulikuwa na mambo mengi.
Sawa. Now
haya kama utakuwa na
Naam. Subiri kidogo nizungumze na mwenzetu hapa Margaret. What kind of help would this family need, or when you hear this kind of stories that this family has gone through in Mombasa, what goes through your mind?
The first thing that comes to mind is I think we need to approach COVID-19 and borrow the practices, very good practices we had when we were managing the HIV and TB. Because of the nature of the virus, there isn't very effective pre-test counseling to prepare you for if it's a positive test or a negative test, what happens. And then the waiting period is extremely anxiety provoking.
Yes.
Again, coming from the point of we don't have too much information, and then the stigma issues surrounding it, and then a post-test counseling bit of it. Then the other thing is we need a lot of community education and sensitization, because after you are done with your isolation, you come back to the society and to the community, and they also have a role. How do we reintegrate these people? They were away for 21 days, so that basically means there is a disruption in terms of their economic engagement. So how do we give them a soft landing so that then they don't have to worry about where their food is coming from and their daily needs and basic needs are coming from, even as they try and fit back into this community and get back on their feet. So there's quite a bit of even psychological support.
Right. Now, Prof, let me come to you. We have been speaking to various people who are COVID survivors, and the one thing that comes out clearly is that they all had very different symptoms, even within families. Some have a cough, some don't. How come the virus, manifests in different ways in different people?
What you need to understand about the COVID-19 is that when you get infected with the COVID-19 virus, number one, you may actually develop mild symptoms where you have flu-like symptoms and you recover. So that is something that manifests in individuals who are infected with this COVID-19 virus. That is one. Number two, there are those who may actually progress from mild symptoms to severe disease. So severe disease is now when they show up with pneumonia, high temperatures, difficulty in breathing, and some of them will recover, And then there are also individuals who now may move from severe to critical disease. These guys are the guys who now require ICU, a facility because their lungs are failing to function. And so these variations that we are seeing in individuals could be explained by a number of factors. Number one, it could be because of their immunity. By the time you are getting infected, how was your immunity? How strong was your immunity? Those who have stronger immunity may end up with mild disease and recover, as opposed to those who have weaker immunity. Number two, we also know that the way diseases in general, the way they come out in an individual is also dependent on your genetic makeup. We know that your genes actually play a role in fighting, making your immunity different from somebody else. So these variations could be either because of immunity or it's because of the genetic composition of this individual.
Oh, okay. And then a quick one, just briefly, Professor. Government tells us to expect a peak around September. When do we know we have actually reached a peak?
What we are hearing about the government and what we are saying about the peak in September, from what I hear from epidemiologists, is that it may not be in September per se. It may be probably early next year, in February or in March. But that one would actually depend on whether we have maintained the intervention that are currently in place, like restriction of movement, from within and outside Nairobi and Mombasa, enforcing, social distancing, wearing of masks in public places. So that can only happen if these interventions are maintained up to around September.
Okay.
If we change those, the strategy, for example, if next week we open the country for people to move in and out of, the high-risk towns like Nairobi and Mombasa, then we will not even know when the next, plateauing will be, because we will now start seeing new infections in other counties which were originally not having a number of cases of COVID-19.
Okay, Professor, my last question very briefly. We're hearing reports of swine flu in China. Should we be worried, briefly?
That's a great question. We have been seeing recently in media of a new flu virus. They call it G4 virus. This virus actually is not new per se. It has been circulating in pigs in China from 2011. But recently it was classified as potential to pandemic. It has the ability to behave like COVID-19. And the reason why it has been classified as such is that while this virus has been circulating in pigs in China, there was evidence of, those who are handling pigs, like pig farmers, who have shown that they were infected with this virus.
Okay.
But the good news is that there is no evidence that even though these people were infected, there is no evidence that this virus has been, being transmitted from human to human so far. But now, what the fear is that if we look at the origin of this new flu virus called G4 virus, this virus is actually, you can trace its origin to another flu virus called H1N1, which actually caused pandemic in the year 2009. And now, if this is a descendant of that virus, and it is now showing evidence of moving into human, then people are getting worried that it actually may start behaving the way the H1N1 behaved in 2009 in humans. Okay. So for now, it is not a big deal.
Right.
Yeah. Go ahead and ask.
No, we're out of time, Prof, and we can't handle all these too many viruses. We're already suffering with the new coronavirus. Just want to thank you for your time, Professor. We're out of time, and also to Margaret Njehia here in the studio, and to all those who joined us, Mzeolo in Mombasa, kila laheri, tutakutakia mema na bila shaka wale ambao pengine wana usaidizi wamekusikia kwa wewe kuja kuzungumza nasi hapa kwenye kituo cha NTV. Now, just before we go, some comments from you, and this is what you're saying to us. Lucy Ngure, it's real, COVID is real, but is it real in Tanzania, our neighbors? Very big question, Lucy. Esther Wambura, you say, yes, it's real. It took away my uncle, Pole sana, Esther, for that. And then we've got Famigio. Tumushabe, you say, no, COVID-19 in African countries, governments want loans. So there isn't anything like the virus, you say. Higher, this is top fan Charles Ngatia. It is, but in Kenya, it's business for big fish. Higher, and another comment here from Pauline Silla. Tanzania should answer this. Since February and no lockdown in that country, ridiculous, you say. And then this Njoguna Jeffrey, I'm busy thinking about my empty stomach. Is COVID-19 still in Kenya? I'm still wondering. And this is Kennedy always. You say, why are the numbers going up only when we near the 30-day lockdown? COVID-19 may be there, but there are people using it in the wrong way. Okay, thanks for your comments. Now, tomorrow, we'll focus on making cities resilient and livable. Our key guest will be the Director General of Nairobi Metropolitan Service, Major General Mohammed Abdallah Badi. That's at 7 a.m. But before that, why not push aside some of the furniture in your living room and make space for a great workout under the guidance of our professional fitness instructors who will instruct you from their homes. That's at 6:30 a.m. Until then, stay safe, have a good day, and thank you for joining us this morning. And thanks to all my guests and our NTV crew and team. Asanteni sana.